Ladies and gentlemen, I'm going to go ahead. It's 7 o'clock, and some of you that know me, you know, there's no 5 minutes after and 5 minutes before. It's right here. If you don't believe that, just ask Nancy about my being on time. Tonight, I'm glad that the town is sponsoring this community forum. We all share a lot of concerns about rural health care right now. It's a major issue. I'm in touch with Burnsville, Spruce Pines, other towns that are in the same situation we are in Franklin. We really don't know a lot right at this point. The other day, the mayor of Highlands called me and asked me if I would come to a community forum up there by Duke LifePoint Parish Hospital, who we have here tonight. And I was very impressed, and I asked Steve and Lucretia if they would come to Franklin and put on a program for us like they did in Highlands and tell us a lot about the services that they have. So this is where we are tonight. So I'll introduce Steve Heatherly and Lucretia Sturgill, who are, I'm just going to turn it over to you guys. And if anybody needs restrooms, they're right through here, not in the courthouse. So they're right here. So. Okay, Steve, welcome.
Thank you. Thank you all for having us tonight. And so I may sit down here in a moment, but first of all, Lucretia Sturgill is our Vice President of Business Development for the Harris and Swain Hospitals. Krista Cooper is our Director of Physician Recruiting, and Sarah Crawford is our Director of Marketing. And so we have done community forums throughout our region for about the past year and a half or so. We've done a couple in Jackson County, a couple in Swain County, a couple in Graham County, up in the Highlands Captures area, and then here tonight. And so we really come here with no agenda other than to talk about what you want to talk about. We don't pretend to know all of the answers for healthcare in our country, nor do we know necessarily all the answers for healthcare in our region. But typically I just start by giving a quick overview of the history of our organization. We're not here to sell you anything. We're really here to have a discussion, hear what's on your minds, and you know how things go really depend on the questions you all ask and what you want to talk about. And so, as I was telling the mayor, we've done these forums for 75 people, and we've done them for 2 people. So this is kind of right in the middle of all of that. So thank you all for being here. But our organization, Harris and Swain, have been serving the mountain communities of West North Carolina for more than 90 years. For a long time, that was as really competing hospitals in Sylva and Bryson City. And then back in 1997, the hospitals, in effect, merged to create West Care. So that may be, for those of you who've been around for a while, you may remember that name. And then from 97 until about 2010, that's the way the hospitals existed: private, not-for-profit, 501c3 organizations, and West Care became this parent company, essentially, that operated both hospitals, all with a local board and really probably the way that your hospital mostly functions today. In 2010, we became a part of an organization called MedWest, which was through an affiliation with Carolina's Health System out of Charlotte, and included Haywood Regional Medical Center over in Clyde, North Carolina. And, you know, quite honestly, in my view, so my history with the organization is I was here from 97 to 2004, and then left for about 4 years or so, and then came back in 2008. And in my opinion, the thing that the organization decided to do in 2010 was really forestalling the inevitable. Our hospitals were struggling financially. Healthcare is a complex business, very capital intensive, and we were not nearing the end of our runway, but it was in sight. You could see out a few years and say, we're not going to be able to maintain the business model that we have. There's just not enough cash to be generated with the way that we operate. So in my opinion, the thing that the board tried to do in 2010 was really delaying the inevitable, which is that, what we attempted to do was we became a part of Carolinas hoping that by being a part of a much bigger organization, negotiating better managed care contracts, and improving our supply chain, lowering our transaction costs, all of that stuff, that we would be able to improve the amount of capital that we could raise to reinvest in our facilities and recruit physicians and all that. But the fact is that was never going to work in the long term. What we really needed was to become a fully integrated part of a much larger organization. So when I became CEO in 2012, we were still in the middle of that management agreement, and it was just not working the way it needed to, and we were much closer to the end of that runway by that point than we had been in 2010. So we began working through a process that took about 2 years and ended up with us becoming acquired by Duke LifePoint. And so the difference in those models is that Duke LifePoint fully owns our hospitals, and they invest in our hospitals as well. The only way that the company makes a return on its investment is for us to figure out ways to take care of more patients in our local community, and we've been relatively successful in doing that. We're coming up on the 4-year mark. So we became a part of Duke LifePoint August 1st of 2014, and so it'll be 4 years at the end of this month. And so a little bit about that organization. Duke, most people in North Carolina know about Duke University Medical Center, so they're essentially our quality partner. Rarely does a week go by that we don't have someone from Duke University Health System inside our hospital. As a matter of fact, today, our senior quality director and our quality coach from the Duke Health Network was with us today to look over some survey scores, and we began a planning process around those. There were employee survey scores. So that's a pretty routine activity. Someone from Duke interacts with us. I would say somewhere in our organization we're interacting with someone at Duke around quality, the patient experience, our care processes, how to become better on almost a daily basis, and then they are typically physically present in our facilities in some form or fashion just about every week. Then LifePoint Hospitals is a company that was formed in 1999. It's a investor-owned, publicly traded company, owns 71 hospitals across the country in 23 states. And the distinction of LifePoint is that the company focuses on rural hospitals. So 65 of the 71 hospitals owned by LifePoint are in small rural communities, just like Silva, Bryson City, and Franklin. So what was appealing to our board was to have a partner who understood the operation of a rural health system, the Duke connection, so that we could see ways to tangibly improve the quality of care that we could deliver locally. And then, of course, this much larger capital partner that could invest in services and facilities that we were desperately in need of. So I'm about to wrap up my speech, and we'll just open the floor for questions. But to give you an example, in the past 4 years, last November we opened a new emergency department at Harris. If you've ever been to our old emergency department, you know that the claim to fame of that emergency department is that The Fugitive with Harrison Ford was filmed inside that unit. The bad part about it is that 25 years later it looked exactly the same, and it was a facility that was designed for about half the patient volume that we had. So we were able to open a new emergency department just within the past month or 6 weeks. We finished the last phase of a new birthing center at Harris, the New Generations Family Birthing Center. And so we're excited to be able to provide that service to the community. We've completely remade our cardiology service line. We did our first cardiac cath at Harris last September, and we continue to grow that program and think that we will likely begin doing cardiac interventions sometime in 2019. We are now in the very early planning stages of considering opening a NICU at Harris because we think that's a service that's needed in the western part of the state. Here in Macon County, we've had a facility here for about 20 years. It used to be called the West Care Medical Park of Franklin. It's now is it called the Harris Medical Park of Franklin? I always forget about our names. But Harris Medical Park of Franklin, it's up off of Holly Springs Drive. It's about a 25,000 square foot facility. We have 4 primary care physicians. We're getting ready to add another provider to that group. Most all of our subspecialists, from orthopedics to pulmonary to OB to pediatrics, rotate through or have full-time offices in that building. We have a full-service lab, most imaging modalities, a sleep center, a physical therapy department. And I think that we see ourselves likely expanding that facility in the next 12 to 24 months. We own some more property up there, and we're trying to figure out how we fit some more square footage and make that more of an outpatient campus as opposed to the single building it is today. And quite frankly, the impetus for doing that is we don't have any more space in that building, and we need to put more services there. So that's a quick overview of our organization. And again, we're not here to sell you anything. We're here to answer questions that you may have, whether it be about our organization, about Duke LifePoint, about the state of healthcare in our region or our nation or our state. But we really do appreciate you having us here tonight. And with that said, I'll just open up the floor to any questions anybody has. Yes, sir.
You'd mentioned that you recognized a need for NICU in this area, NICU service. What other needs do you feel are being underserved in this part of the state?
Well, so the list is long, but so let me first, I'll answer that question at the tail end of this and say one of the challenges that any hospital operator has is that there's almost a limitless demand for services, and no matter how big you are, you've got a limited amount of resources, whether that's capital in the form of dollars, human capital, time, things that you can spend your time on, however you characterize that. So what we see when we do a strategic plan, we really try to focus in on 3 to 5 key areas that we think we can make the biggest impact for our region on. So right now, those service areas or service lines for us are cardiology, orthopedics, women's and children's services, emergency medicine, and cancer services, and primary care. So those are kind of the 6 things that have been, we're about to finish our 2019 strategic plan, so those will be the 6 areas of focus for us for 2019. Now, when you could break down each one of those and come up with a lot of missing parts that the region has. Fundamentally for us, though, even when you get outside of those service lines, things like access to neurology, access to rheumatology, access to endocrinology are all areas where there is massive demand, huge wait times to get in to see a specialist anywhere in Western North Carolina. So as a part of our strategic plan, we also put together a medical staff development plan that prioritizes what the physician specialties that we think we need to focus on. So when we think about that for 2019 and beyond, I think We need to continue to grow our primary care footprint in Jackson County, Macon County, Swain County, and probably into Graham County. We need and we need to continue. Women's and Children's Services obviously has been a hot topic in this region for about the past 18 months. We need to continue to expand access to those services. I will say that part of the ethos of our organization is that we believe very strongly that we need to make as many services locally available as we can. Doesn't mean we can duplicate everything everywhere, but for example, when we needed to respond to the fact that labor and delivery was closing at Angel, obviously the deliveries are done at Harris, but we didn't want to take for granted that all of those patients, for all of their prenatal care or for the pediatric care that would follow it, need to come to Silva every time that's done. So within a span of about 120 days, we opened a full-time pediatric office here in Macon County, and we opened a full-time OB office. And, quite frankly, we've stretched our human resources pretty thin in doing that, so we need to backfill in some cases. So we continue to see recruitment of OBGYNs, certified nurse midwives, and pediatricians being pretty high on our list. I think orthopedics continues to be an area that the entire region struggles with. We added an orthopedic surgeon in 2017 who is the only total joint fellowship trained orthopedic surgeon west of Asheville, and he's tremendously busy, and we probably need to look at another orthopedic surgeon sometime in the next 12 to 24 months. Obviously our region has an aging population. I think we're going to have to start thinking through, I would tell you this is not on our 2019 strategic plan, but I think we're going to have to start thinking through kind of a formal subset of primary care focused on geriatrics, because that's a growing need in our region. But the supply or the demand of things that our population needs is almost limitless. We've got to be focused on what we can have the biggest impact on. Yes, sir.
I've got a concern, and as I understand it, this sale with HCA, between Mission and HCA, is dependent on the Attorney General approving it. If for some reason the Attorney General should not approve that sale, and I'll just let the elephant out of the room, would Duke LifePoint be interested in this hospital?
So I can't speak on behalf of the entire.
It's my turn to put somebody on the hot plate. I get it all the time.
But I can always make a Steve Heatherly editorial comment.
Yeah. That is an issue.
That is the elephant.
And so I will say this. From my perspective of having been in Western North Carolina for, professionally for the last 25 years or so, even the 4 years I was away, I wasn't far away. So I would say, from my perspective, what makes the most sense for, I'll call it the market from Jackson County west, is to have some form of tightly integrated system where people in contiguous counties with overlapping populations are working collaboratively together to figure out how to provide health care. That's what I think makes the most sense. Now the reality is, and you probably remember me saying this in Highlands Cashers, I don't get to tell Duke LifePoint which hospitals it buys, and I don't get to tell Mission or HCA or whoever it is which hospitals they sell. So the fact is that I think, the devil's always in the details, and subject to all of that, I have a sense that our company would be interested in creating such a system in Western North Carolina. The everything's got to be right. The timing's got to be right. The specifics of how it gets put together have to be right for a lot of people involved. So that's a long-winded way of saying yes. That's also not an official statement on the part of Duke LifePoint.
One other point about that meeting in Highlands, I would say it was overwhelming, just exactly what I said with Highlands Hospital. And I've been talking a little bit with some of my counterparts up there. There's no reason why Highlands should be separate and we be separate down here. We're in the same county.
Sure.
And I think we need to be looking at some collaborative efforts, even in the medical field, as well as the other fields that local government has to deal with.
Yeah, I don't disagree. And I would extend that to say, when you think of Jackson, Swain, Macon, Graham counties, we serve or we have an overlapping population, and figuring out how we collaboratively, efficiently, and effectively make the healthcare services that should be made available as locally available as possible, and then what we don't or can't make available locally, we have a good partner to send that on to. But I agree that that's the best system to have for the citizens of all of those western counties. Yes, ma'am.
Does Harris use Mission as where they send people? Or?
We do. We consider Mission. We have a complex relationship with Mission. They are our primary competitor. And they're our primary collaborator around certainly the tertiary level services that need to be made available for the people that we serve. I will tell you that the tension becomes around the definition of what can be provided locally versus not, and that definition changes over time. I'll give you an example. 20 years ago, probably, you wouldn't have considered having a cardiac cath outside of a tertiary hospital. Now it's commonplace. Same thing with spine surgery. 20 years ago, you wouldn't have considered having spine surgery outside of a tertiary hospital. Today, people are having cervical fusions and going home the same day because the technology has changed. So I think as that continues to evolve, our ability to provide more and more services locally will expand, and we intend to be aggressive about doing that. Yes, sir.
You never get in the way of a politician and opportunity to say something. I'm going to hush. Just one thing that I did want to mention. How does Western Carolina University and their big emphasis going on the medical fields could play in this?
Well, we have an incredible partnership with the university, which is formalized. It's called the Ascent Partnership. You may have read something about it. So our relationship with Western Carolina University spans everything from being a destination for students to do their clinicals in our facilities, and that's probably true of every hospital in Western North Carolina. Our orthopedic surgeons are the team physicians for all of the athletic teams at the university. We operate 2 on-campus clinics at the Health and Human Sciences building. So we have a primary care clinic on campus at Western, and we also have a rehab clinic on campus there at Western. We sponsor their arts programs, and I could go on and on. We have an incredibly integrated relationship with the university. So I think from training the next generation of healthcare worker to understanding that, the mission of our organization is making communities healthier. And the most obvious way we do that is to provide access to healthcare. But there are lots of other ways for communities to be healthier, like the arts programs and all of the things that happen at Western Carolina University, and we're the prime sponsor of most of those activities. The other thing I would say, equally important to us, is a partnership that we just announced with Southwestern Community College. Actually, let me finish one more thing about Western. We also sponsor nurse practitioner students to go through their program and then come to work for us after they finish. So we've put our first 2 through. We've got 2 more in the program right now. And so that's a part of our goal of expanding access to care in the region. Southwestern Community College is also an important partner for us. We just announced this thing called the Student Nurse Apprentice Program, or SNAP for short, where we are sponsoring, I think it is 6, is it 6?
2 RNs, 2 CNAs.
Okay, so it's 4 students to go through their nursing programs each year for probably time immemorial, because we can't hire nurses fast enough. So we pay for them to get their education, and they come to work for us afterwards. Any other questions?
Yeah, I got one. So I got 2 actually.
Okay.
So how would you compete with HCA's pool of medical residents that they claim to have at an Inca, which they identified as one of the things that Angel had to kind of worry about constantly when they needed more medical personnel?
Yeah, I don't know about that specifically. What I would say is that it's great to have residents as a part of your system, and then it's another thing to get them to come work in a rural community afterwards. So I think the fact that you have a rural residency program is better than not having one. We have I would say this. Number one, we have a great physician recruiter. She's sitting right there. And number 2, we have a lot of infrastructure within LifePoint to support our local efforts. And then we're blessed to live in Western North Carolina. So, I said LifePoint operates hospitals in a lot of rural communities. And when I talk with my colleagues at other LifePoint hospitals, they're pretty envious that we get to recruit physicians to Western North Carolina. So we've had a tremendous amount of success. And I would tell you, this is not necessarily something new that LifePoint brought to us. The back-end resources to provide candidates, the pace sometimes at which recruitment can happen has been sped up. But we have a pretty long-standing history of being successful recruiting physicians into our system. So to put that in some more recent context, a year and a half ago, Asheville Cardiology announced that they were closing their office in Silva, and today we have 3 cardiologists, 2 of which were hired in less than 90 days after they announced that they were closing the office. So we were faced with the challenge of we might not have any cardiologists in Silva for a period of time, but we have 3, and we have expanded services dramatically as a result of that. Same thing with OB. We went, we had really 2, well, we had 3, but 1 was leaving, and we had a nurse practitioner in our OB practice when Angel made the decision to close labor and delivery. Within 120 days, we hired 3 certified nurse midwives and another OB physician, and we're about to add 1 more midwife and 1 more physician. So we'll end up with 4 OBs and 4 midwives. And that's all in really less than a year. So I feel whatever residency program there is that can be a pipeline, I feel pretty confident in our ability to attract talent. Now, some things are tough. We need a urologist badly. And there is... for every open position, let's see, how does it go? For every 1 urologist available, there are 2 to 3 open positions in America. So, the odds are tough. But so some things we struggle along with everybody else. But for the most part, we have tremendous success recruiting people into our system.
And second question, when Karen Gorby had come here last week, she had mentioned that in a way that HCA has proposed to give health care to the indigent around here. They announced the Dogwood Trust, and she had kind of compared it to your equivalent and said that it would have more buying power per dollar. How would you kind of maybe answer that or square that? And are there any other ways that you might consider bringing healthcare to the poor?
I don't know anything about that specifically, but what I will say is that if you annualize our current numbers this year, we will provide about $20 million worth of charity care and essentially uncompensated care to our communities. And so how that compares to what Angel does either now or as a part of HCA, I have no idea. But we believe that there must be mechanisms in place so that people who otherwise would not have access to health care can have access to health care, up to and including we sponsor 2 federally qualified health centers, with one with a community benefit grant and one we're partnering with to just make services available to a location in Robbinsville. So I think that's very important. I will kind of pivot politically for a moment and say that the single greatest thing that needs to happen in the state of North Carolina is expansion of Medicaid to provide for indigent care. And we need to figure out how we're funding our behavioral health system. We figured out how we're not funding it, but we need to figure out how we're funding it. Yes, ma'am.
You talked about a sort of a limitless list of things that people need in the area. What made you move the birthing center up to the top of that list? Was it Angel closing the labor and delivery unit?
No, we were already doing that. Women's and Children's Services has been a long-standing strength of Harris. And so we had designs on the birthing center for probably 5 years. Frankly, before Duke LifePoint, we didn't have the money to do it. And so that was a part of their commitment when we became a part of the Duke LifePoint organization. So we actually faced a choice, though, I will say, because there was a period of time where some midwives who worked at our hospital, they weren't employed by us, they went to work for Mission, and we were seeing a diminished number of deliveries at Harris, but quite honestly, from a strategic perspective, we just decided to stay the course. And it really became a competitive issue for us. And there's nothing wrong with that. Sometimes you make decisions because it's the right thing to do for the community, and sometimes you make decisions because it's the right thing to do for your organization, and down the road, that turns out to be the right thing for the community. Excuse me, and I think that's what happened in the case of labor and delivery. So by virtue of a decision we already had made, we were positioned well when Mission made the decision about Angel with expanded capacity. Our rate limiting factor at that time was, did we have enough people? And the answer was no, but Krista figured it out. Yes, sir.
Jackson County's experience moving from a nonprofit to a profit hospital, how did the community feel about that? How did it affect the community, positive or negative?
I think the initial response was overwhelmingly positive. I think we were pretty transparent in explaining to the community and various stakeholders, whether it be the county commissioners or community groups like this, or Rotary, whomever, that the reality for our hospitals at that time in the business model we were in is there was an end date that it was a few years out, but there was going to be an end date that if we kept doing the same thing, our hospitals would cease to exist. And so we were open about that. And we were open about our need to find a different business model. So I think by virtue of having been open with the community, transparent about it. Now, to be fair, for those of you who were around at the time, there were a group of physicians in Jackson County, about 4 of them, who jump-started that process because they were really mad at Caroline's health system. So they went to the county commissioners and said, we need to bail out. And we want to become a part of Mission. And so our board did a really good job of slowly and methodically walking through a process to figure out what the next iteration of our hospitals needed to be. And so I think overwhelmingly in Jackson County, what you see today, and in Swain County, what you see today is that people are incredibly positive about the experience because Duke LifePoint has done what it said it would do. It has invested in our facilities. I mentioned big projects at Harris, but at Swain we put in a new state-of-the-art CT scanner. We've developed a pain management clinic that serves our entire region out of Swain County. We've expanded swing bed access, which is a much-needed service, out of our Swain Hospital. We've recruited new primary care physicians to that community. So I think the community response, today is overwhelmingly positive because the company did what it said it was going to do.
Steve,
Yes, sir.
Steve, I got just a concern and a question about. I've just been here a year so far, and I've got my United Healthcare with this area, and they've got an emergency room here at Angel, and not much more than that, I understand, as far as the hospital goes.
Mm-hmm.
And they're affiliated with Mission in Asheville. Am I right so far?
Yep.
And,
Well, I don't know about the service. They are affiliated with Mission. I wouldn't make a qualitative statement about that.
And y'all are in Silva, which is
Yeah.
a lot closer than Asheville.
Yeah.
If I get sick, I end up in the emergency room.
Mhm.
And I talked to United Healthcare today, and they said, well, yeah, both places are in your network.
Mhm.
And I said, okay, so if I get sick, end up in Angel, and they say, well, we can't take care of you, we got to send you to our other hospital and all the way to Asheville,
Mhm.
because that's where we're affiliated with Mission.
Mhm.
And I said to my person on the phone, I said, well, why can't I just go to Harris in Silva? It's a lot closer for me. It's a lot closer for the patient, of course, and for my family or whatever. She said, well, it's in the network. Just tell them you want to go to Harris.
Mhm.
And I said, well, if I'm in the emergency room, hopefully I'll be able to talk.
Yeah.
And obviously, is a Mission affiliate, Angel, going to send their reports from there to you in Silva? See where my questions are here?
Yeah, I do. So what I would say is, number one, I think the guidance that you got from United is correct. If you're in a position to request to be transferred to any facility, then that request has to be honored. I think number two, folks will, I get the whole issue of system affiliations and all of that. I think generally speaking, folks are going to do the right thing. So we see a lot of patients at Harris from Macon County, some who come through the emergency department and then are subsequently transferred to Harris. And, I'm sure, no doubt, as a result of being a part of the Mission system, there's probably some scripting that makes Mission the first thing that's mentioned. But at the end of the day, we get patients from Angel all the time, certainly on an elective basis.
How do they get there?
Well, depending on the condition, but by ambulance, probably if you're coming from the ER.
Very good.
And so as far as the records go, yes. Now, we don't have a seamless electronic transfer of records, but the records that are pertinent to your care will get sent along with you.
Okay, that's important, because, if Angel Hospital is going to remain an emergency room,
Mm-hmm.
which I see it right now, it's what it is. And so we're dealing with two hospitals. We're dealing with Silver, and we're dealing with Asheville.
Mhm.
Where do you want to go? You mentioned a cath lab.
Mhm.
That's important.
Mhm.
And that's usually what happens to people as we get older. But,
Yeah. Well, and somebody asked the question a little bit ago about our relationship with Mission, and so that's an important part of it. If our cardiologists evaluate a patient and they decide that we're not the safest place for that patient to have their cath done, chances are we're going to send them on to Asheville because that's the right thing to do for the patient.
But living here in Franklin, I can go from Franklin to Silva, hopefully get it taken care of, and then from Silva to Asheville, even though I'm bouncing between two corporations?
Absolutely.
That was my question.
Yes, sir.
I
Yes,
would
sir.
just say, after spending many hours in the emergency room for the last 24 years, I've sent patients just, well, not everywhere, but to a lot of different places. And Steve's exactly right, the final call is yours, regardless of affiliation. I will also say that before anybody is sent, there's a physician-to-physician phone call, because that patient has to actually, that physician has to accept you. So if I'm in the ER talking to a physician, it doesn't matter, Harris, Asheville, whatever, I give them the story, but they have to actually accept you before you, in other words, they have to realize they have the facilities and the personnel to take care of what's wrong with you. So, I wouldn't worry about, records will go, that's not an issue. I always make sure complete records accompany the patient, so, yeah, you can go where, but it's your call is the point, and there's always a physician-to-physician communication before that transfer occurs.
Thanks.
Dr. Willard, if that was to happen, and you're not responsive, you're in the emergency room, you don't know what's going on, you can't tell anybody where you want to go, is there a system set up, say at Angel, that we could say, if we cannot speak for ourselves or a family member, our first choice would be go to Harris. If they do not have the facility there or the doctors there, then Mission. Is that a part of a system that any of the hospitals have?
Well, I would say two things. One is, I think everyone should have a living will where you clearly document your wishes. We give them out in the office. We use a booklet called 5 Wishes, but it's for you to expressly put in writing your wishes if you're not able to make those decisions. So number one, this should be taken care of ahead of time, not waiting till stuff is happening.
That's my point. Can we do that?
But, and, if somebody's not able to make those kind of requests or determination, but the family's there, then that's the next thing we go by. Now, obviously, if your condition is such that Haywood or Silva isn't able, if it's something that's going to require neurosurgery, for example, that's not even a discussion, it's, you go where they have those capabilities to deal with that. But I would say, importantly, to try to put those things in writing now, these are my wishes, and have that document available.
Thank you.
Can I answer any other questions?
I understand you're at Duke Hospital, but how much better is UNC than Duke?
Well, I'm a UNC graduate, so they're a whole lot better.
You guys are covered.
But obviously Duke is internationally renowned from a healthcare perspective, but what they have done, and I don't think this was an overnight thing, they have developed a quality program that is scalable to the size of a community hospital. So I don't have a lot of conversations with people at Duke about highfalutin things that are never going to happen in Silva. We have very practical discussions. So for example, the development of our cardiology program is a great example. We were starting from zero, scratch, never in the history of our hospital, never having done a cardiac cath. And the person who helped us walk through that clinically is a guy by the name of Harry Phillips, who is the chief medical officer for Duke LifePoint. He's an interventional cardiologist who practices at Duke University Health System, and he's been with us every step of the way in developing that program. And we've still got a lot more work to do. Twice a year, I have to go to Durham and stand in front of the chiefs of Duke Medicine and present the quality results of our hospital. And we're held accountable for those results. And if you know anything about hospital quality, sometimes things go well, and sometimes they could go better. And what we all understand is that improving quality is a daily activity and a journey, and we've got the support of Duke University Health System in doing that.
Thank
Sure. Yes, ma'am.
Can you say yes or no as to whether Duke LifePoint is watching this community and what's happening with the services here and what's happening with the struggle with Michigan and HCA?
I can say yes. Yes, we are. You know, we have and I will tell you, however it turns out, I'll be so bold as to say we are going to be a part of the provision of health care in Macon County. Now, you know, it could happen, you know, in one way, in a really big way, but if not, we're going to continue to expand services. We're going to continue to integrate services. We're going to continue to be hopefully appealing to people in Macon County to use for health care. And, you know, we're going to do that by sticking to our mission of making communities healthier and making as many services as we can locally available to this community and well integrated with our hospital services in Silva. So I can tell you that we've had a vested interest in our former iterations for 20 years, and we're going to continue doing that. That's the intention of our organization. Yes, ma'am.
I want to go back to his question. Recently, we had a friend in our church who was in an accident. She had a living will, and it went further than that. She had a copy also given to her children, and they had it so readily available at their home. And I think the daughter lived in California. They got in touch with the daughter, and they were able to tell the medical people what her wishes were. This is real important. If you have a document made up like that, you need to have it given to your family members so that they can have it readily available without putting it in your box in the vault in the bank and that kind of thing where you can't get it. This is very important, so I just wanted to pass that on.
Thank you. Any other questions?
Well, in most hospitals, you can provide them that document ahead of time. You could take it to Angel and you could take it to Harris and say, is that
That's
true?
correct.
Harris? And then they have that on file, so you can be proactive in being ready in case of an emergency.
Well, thank y'all for having us here tonight. I would be remiss in saying, and not saying, that we have a lot of propaganda up here. And you're welcome to help yourself to it.
We really appreciate Lucretia and Steve and the other folks from Harris being here tonight. I just want to say, Franklin is not alone. We've got Burnsville, Spruce Pine, several other towns whose local governments are wrestling with the same thing, and their communities are wrestling with some of the same questions that we have. Particularly labor and delivery pretty much started. And I'd be remiss to say if there's another politician here tonight. Brandon McMahon, who is on our town council and is one of my right-hand people, and I appreciate him so much. But thank y'all. You're welcome in Franklin anytime. Please come back and see us often. And y'all are welcome to hang around and talk among ourselves. So, thank y'all.
Yeah.